and this will be available online, and I will pass it to Sylvia.
Hello, everybody. Sylvia Lim. I'm the finance officer with the division. I'm here to help answer questions on any of the compliance that you may have. Thank you. I'll pass it on to Hannah.
Sylvia. Hi, everybody. My name is Hannah Perveen. I'm also on the Lead and Toxics program as an educator consultant. I'll tag Panay.
Hi everyone, my name is Panay Amsalu. I am with the Lead and Toxics program. I'm a project and program manager. I'm here to support. I will pass it to Phil Thompson.
Hi, I'm Phil Thompson. I am the contract specialist who handles all the contracts and RFXs that are funded by BSK. I think that might be all the King County people.
Okay, Mary Kate, you want to go?
Hi, everyone. My name is Mary Kate Carden. I am the co-director of the Region 10 Pediatric Environmental Health Specialty Unit based at the University of Washington.
Great, welcome. Is it Anna or Anna?
It's Anna. Good morning. Good afternoon, everyone. My name is Kiana Daniels. I'm the administrator from Children's Nursing Services. We are a home health agency that focuses on providing skilled nursing, home health services, and mobile lab testing.
Great, welcome. And Lace?
Sorry, I am a grant consultant with Small Health Board and some other interested clients.
Great, thanks for being here. Am I forgetting anyone? I think that's it. Okay. So we're going to talk about key elements of the RFP, some of the criteria, a timeline, and answer your questions. So next slide, Ashley. So you can put your questions in the chat box. And I think Ashley and Phil are both going to be checking the chat to make sure that I don't miss anything. We're also a small group, so I think you can also raise your hand too. I'm fine with that. Okay, next slide. So just a little bit, whoops. Okay. So just to review that lead is a neurotoxin and there are no safe levels of lead. Lead does have disproportionate impacts on communities of color and low income communities. That's why we have our focus on these communities. There is limited awareness in the general public of the issue of lead poisoning and lead exposure sources. King County has very low testing rates despite the policy that requires that Medicaid eligible children are tested at 12 and 24 months. We have some of the lowest testing rates in the country, unfortunately. And there are a lot of, we know a lot about sources of lead, but we're sort of learning more all the time about new sources. So these include, paint that I think most people are aware of, but also a lot of culturally important items like certain cosmetics, cookware, spices, jewelry. So lots of different sources that we see in King County, and it's changing all the time. Next slide. So this RFP is in response to the low blood lead testing rates in King County. This RFP was developed to reflect our community's priorities. The Lead and Toxics program has had a CDC childhood lead poisoning prevention grant for the last 5 years. And we've engaged community directly through all those 5 years and have learned a lot about what is the most important thing to our community partners. And we have heard over and over again that they want their providers to bring up blood lead testing. They want it to be easy to get their kids tested. They don't want to be the ones that have to initiate testing. They want their providers to be looking out for them and their families. Testing is important to identify blood poison children because we need to find and remove the sources of lead from the child's environment and link children to developmental services. The Environmental Health Division has case managers, case investigators, who, when there's a child that's identified with elevated blood lead, there is an investigation to try to find out what the source of lead is in the home so that it can be removed and prevent further exposure. So that's very important. So next slide. So the primary goals of the RFP, we want to educate and engage pediatric providers about the importance of blood lead testing and effective referrals for developmental services. There's a lot of hope for children who have been exposed to lead. Developmental services can be very effective in helping kids catch up and to mitigate the effects of the lead. We want to a partner to provide technical assistance to pediatric providers to implement quality improvement measures that increase blood lead testing rates and improve access to developmental services for lead poisoned children. So some examples of that: electronic medical records flags, peer-to-peer education and support, possibly CME. And then also, something that we heard from community is that they want to have blood lead testing events that are free and easy to access. We actually did some community blood lead testing events several years ago before COVID and had really good feedback from our community partners about those. And participation in the Lead Action Group. This is a group that is funded through Best Starts and through CDC, and is a group of community partners who have been, some are newer, but some have been working on lead issues for years. And it's really important for the agency or organization to be hearing from the Lead Action Group about their priorities and their input. Next slide. So focus communities for this RFP: pediatric providers and other medical personnel who serve children at increased risk of lead exposure. And the focus communities that are at increased risk of lead exposure include, but not limited to, Medicaid eligible children and their families, immigrant and refugee families with young children, and Black, Indigenous, people of color families with young children. Next slide. So organizations that can apply or be competitive do not have to have a background in lead and toxics work, though that's certainly helpful. But ideal applicants have a strong tie to pediatric providers and to the focus communities, a passion for environmental justice and health equity, and experience working collaboratively to design community-driven programs. Next slide. So just a summary, we have $900,000 total available. That's over 3 years. The due date is May 8th at 2 o'clock in the afternoon. We're looking at a contract period of August 2023 to August 2026. The request limit is 900,000. We may not award that much, but up to 900,000. And we don't anticipate more than 1 or 2 awards because we really want we're really looking for an agency that can pull it sort of all together. But it could be a group of organizations getting together to submit one application. But we wouldn't want to, our priority would not be like to fund one organization to say, do the blood lead testing events, and then another organization to do the pediatric provider education, because it's so important that it all be very well integrated and coordinated. But organizations could collaborate together to meet all those expectations of the RFP. Next slide. So we released on March 20th. This is our first info session. The deadline to request technical assistance from our TA providers, our BSK TA providers, is April 25th. That information is available in Zoom grants, and we can certainly get that information about TA to you as well. If you have questions for Phil in contracts about requirements, or any of those questions can go till April 28th. Due May 8th, again at 2. We're going to be reviewing and rating proposals middle of May. We hope to notify folks of decisions in early June and talk about contracts in mid-June, and then hopefully a potential start date of August 1st. Next slide. So the review panel, the RFQ or RFP rating and review, the panel participates in a 3-hour equity training together. We have a strong commitment to making sure that the review is fair and unbiased. So the 3-hour training is something that, like I said, everybody does together, and it's specific to the proposal too. It's not a generic kind of training. And so it's very relevant to the folks that will be scoring the applications. And the review panel closely follows the scoring criteria that's provided in the RFP. And all proposals will go through the formal review process. And then the next step, so the review panel makes its recommendations, and then those recommendations go to BSK leadership, and then finally to King County Council for final approval. Next slide. So this is the just telling you a little bit about the free technical assistance that's available to support you in preparing your application. So TA providers can assist in determining whether that's a good fit with your program, provide guidance on answering questions and where to find data, and support application review, including editing and budget review, but they do not do grant writing. And so if you think you might need TA, I would suggest getting in touch with those folks as soon as possible. Next slide. So our next info session is March 30th at 9 o'clock in the morning. Questions about the RFP should go directly to Phil at CPress, and here's the email, and this is also in Zoom grants. You will need to contact the technical assistance providers directly for support. There's a lot of information in the RFP. Please review it carefully. There's a glossary of terms. There's a lot of information in there. It's a long document, but it will help to make sure that your application is complete and that you're answering all the questions and meeting all the requirements. Next slide. That's it. So I'm looking at the chat. Oh, is this is when we started, Kiana?
It looks like Kiana's question, she shares a bit of background about her program and organization, and she's curious if the organization is not
Okay.
a nonprofit.
Yes, you
Are
can
they-
apply if you're not a nonprofit.
Thank you.
Yeah, welcome. Any other questions? You don't have to put it in the chat. I think they're just, there aren't that many folks here, so.
I have a quick question for a client like Somali Health Board who supports immigrant and refugee communities specific to the East African areas, diaspora. If they applied to this, would that be too narrow of a service category if you're only doing 1 or 2 awards?
Well, I think they would need to complete all the questions on the.
No, that's not what I mean. I just mean that they don't serve like their services are open to everyone, but they aren't necessarily connected to the Latinx community. For example.
Oh, well, I think that's a good question. I think they would need to make a good case for how they could reach out to additional populations. I mean, I think the question would be, what is your reach? Like what, who will you serve? Who will you reach? And of course, the more populations that the at risk, the focus populations, the better. But the communities that you just mentioned are certainly part of the focus of this RFP.
Okay, thank you.
So I guess a sort of a more complicated answer is I think it will probably depend on what other applications there are. Like if somebody else has a proposal that serves more children, more families, then a Somali Health Board proposal may not be as competitive. Or Somali Health Board puts forth a proposal that is the most expansive of any of the ones that we have. Is that helpful? I mean, I guess I would say the fact that they don't currently serve Latinx families would not mean that they wouldn't be eligible to be funded. I mean, it's difficult for any organization to serve all of those focus populations, right?
And if I can just add, part of the action groups that the awardee will be a part of also has members from organizations that serve many diverse communities, including the Latinx community. So they would be a resource and tool to any organizations who are wanting to expand and think together thoughtfully with folks who are from those communities about how to do that.
Yeah, that's a really good point. Thank you. Does anyone have questions about the fiscal side or the contract or requirements around insurance or anything like that?
So, this is Kiana. So kind of what I'm gathering, from the RFP is that you're wanting 1 or 2 organizations to award this grant to. If I guess my thing is, what are you kind of looking for if you're wanting one particular organization to kind of provide all of the things? Or is it more like, okay, this organization handles the kind of the outreach portion of it. This organization handles the physical testing portion of it.
So the preference
I guess
would
I'm trying to
be,
get a feel for what you're wanting.
yeah. So the preference would be an organization that can do all the components. So that there's really great integration between all of the activities, but it could be that a couple of organizations get together to provide one application and one coherent plan for how they will meet all of the requirements for the RFP. I think the reason that we were like, well, we could do two is if we did see two applications that were just a really great complement to each other, that could be possible. But ideally, it would be one organization to have the biggest impact with the funds that we have available.
Thank you.
This is kind of related to Kiana's question, but if there were two awardees or multiple awardees, would they be working together at all? Outside
Yes.
of, I guess, that group, they would be, okay.
Yes, they would really need to be working together.
Thanks.
So, Ashley, Fanae, or Hannah, is there anything that I forgot to mention or something that is important to you that you want to share with folks? I mean, it's fine if you don't, but I just want to make sure you had the opportunity to share.
Just to give a little bit background about the LED Action Group. The LED Action Group is composed of 8 community-based organizations from diverse community members. So their primary role is to support the successful applicant for this project. Yeah, I just want to add this one. Thank you.
I have another question. I don't want to feel like I'm hogging.
No, please.
So just to kind of get a feel, like, how far backed up are we? Like,
sorry?
how many, can you hear me?
Yes.
Okay. How, approximately how far backed up are we in testing? Like, how many children, who, we have not tested who needs testing? Like,
Only about 30% of Medicaid eligible kids are tested in
what
King
would be
County.
needed in, I'm sorry.
Only about 30% of King County children, Medicaid eligible children, are tested, and it's a lower percentage in the general population
Okay, so only about 30%. So
of
that would be
Medicaid eligible children.
of
Yeah.
Medicaid eligible.
Mm-mm.
So that would be approximately, so the 70%, what is that in terms of numbers? I guess I'm just, because when you're kind of looking at these, you're kind of seeing, okay, what would be the staff capacity? How many, how many testings are we approximately going to be doing every week, every month, to kind of get us up to speed, because
Well, I don't, and any other staff chime in, but I don't see the blood lead testing events as the primary avenue for increasing blood lead testing rates. It is a way to test some children and to raise awareness of testing, but the primary way that we want to increase testing is by having providers, families' own providers, initiate testing with appropriate children. So the testing events are really, I think, a small part of increasing testing. It's really about changing providers' attitudes and about systems to make testing just happen kind of automatically when it should, instead of instead of telling families and just trying to, I mean, we've been working really hard on raising awareness with families. We also did continuing medical education a couple years ago, but we have limited staff capacity. And so it's really, I think, a systemic change that we want to make here. Does that help?
So it does. And I guess so what are you, because you're wanting, we're obviously wanting to get for King County residents to be able, when they go in, when the kiddos go in for their pediatric visits, to be able to also get the testing done at their time. What is being, I guess my biggest question is why is it not being done? What are some of the issues that you're seeing on why this isn't why so many kiddos are being basically fall through they're falling through the cracks? Like is it the pediatrician offices that need more of the training? Because typically when parents will bring their children to the pediatrician, like the pediatrician will like, oh, okay, well, these are such and such things that need to be done. So I guess
Right. That's not happening.
where's the disconnect that you're seeing?
Right.
Okay.
Providers are not doing the testing when they should be doing the testing. And reasons vary between some providers saying that they're not aware of the guidelines. They don't know what to do. They're not sure where to refer a family if the blood lead test does come back elevated. But I think it's primarily lack of awareness among pediatric providers of risk exposure and about communities most at risk and about current sources of lead exposure. I think they're just not, they're not aware. Yeah, I think many are not aware of the guidelines. And Mary Kate, I saw your hand is up.
Yeah, thanks, Amy. I was just curious if there were any restrictions to how the funds can be utilized, like thinking about the testing events, like could some of the funds be utilized to purchase a point of care lead testing machine that could be brought to these events, or could the
Yeah,
funds be used
I
on
think
it?
so. I think it would just need to be a well-rounded proposal and reasonable budget. I think, like, I know we talked about in the RFP the idea of partnering with provider offices to do the blood lead testing events. And so some of those will have point of care machines already, but it seems perfectly reasonable that might be part of a proposal that for example, for community events where you don't have a sort of sponsoring clinic partner, that purchasing the machines would be reasonable.
Okay, thank you. Sorry about my dog.
Oh no, I don't. Was there a dog that we missed? I don't know.
Yeah, that's him barking
I
away in
see.
the background.
I can't even hear him. And Anna, did I answer your question all the way?
Yes, you did, because I was just trying to see, where was the disconnect happening? Is it the providers are saying, well, we don't have enough staffing to do this test, or we don't have access to these tests, or, so, yeah. So I
Yeah, I
was
mean,
just,
we've heard
Mhm.
some providers say that they're, a venous test. So there's two kinds of tests for blood lead testing. There's the capillary test that's done with a finger poke, and then there's venous testing, which is, a needle in the arm. And some providers saying that their families don't want to do it, or just that it's difficult to test small children to do the venous draw. There are, I mean, lots of reasons that they give for not doing it.
Mhm.
And sometimes they recommend it and send families to the lab, and the families don't follow through and go to the lab because the provider office doesn't provide the venous testing on site. They have to send them to a separate location, which is a barrier.
Yeah, you want to test, at that, at a particular place, and, I have an 8-month-old, so it's like, okay, so I got to leave here and go somewhere else
Right.
and do everything else that I need to do for today. I can't get that done.
Right.
So yeah. Okay.
Can I also share, Amy? As I know one part of the question was kind of like, how do we make sure that our proposal is meeting the number of kids who need to be tested? And I just wanted to share that kind of part of the process of the RFP, you will submit kind of a budget, an estimated budget. But if you're selected and you have the skills and the tools and the resources as an organization, the budgeting process is also collaborative. So you don't have to worry too much about being perfect in your initial budget and getting the exact, mystery number of how many kids we're expecting you to test. That'll be a conversation that also happens after the RFP process as well. So it's kind of like setting a baseline of what you think 2 or 3 events would cost, and then we can have a conversation back and forth to make sure it's reasonable. And
Any other questions?
So, I'm thinking about the process in this. So, so the organization will go in, would do the testing. If it comes back positive, then if the provider doesn't know what to do, or as an organization, we kind of have to kind of hammer out that process, while also working with the pediatricians as well. Or are we to get, like, what to do next from the pediatrician? So I guess I'm just trying to see how the communication, and I understand that's probably, one of the things with the RFP is to kind of hammer out that type of communication, but kind of what you guys are thinking about how that flow would go.
Yeah, I mean, I think you're right in that we're looking for proposals that lay that out clearly, but just so you know, like when a child tests, all of the reporting goes to the Department of Health, whether it's a result that shows elevated blood lead level, or that is below the action level of 5 micrograms per deciliter. And so DOH then connects with public health to do the case investigation. But it would be important for the organization to facilitate communication with the family's provider so that the provider is aware of that the test has been done. Because that is not part of the loop necessarily. When a test is done by the child's pediatric provider, they would get the results. But if you're doing a test outside of that child's pediatric provider, then they would need to get that information and make sure that they're doing the appropriate follow-up with the child's family, like retesting at the recommended period of time, making sure that the family gets appropriate referrals for developmental services and all of that. So you really want to facilitate that child getting and family getting that care within the clinic and provider that they have a relationship with.
Thank you.
Sylvia, do you mind just talking really briefly about sort of the fiscal side, like just what kind of fiscal monitoring is sort of part of the BSK world for folks who may not be familiar?
Sure, I can do that. Yeah, I just want to make sure that when we um, have a contractor, that the contractor is aware of the type of documents that they will need to submit. So for one thing, of course, they would want to submit invoice on a regular basis, and we expect invoices to be submitted on a quarterly basis, unless there is some requests to ask for a more frequent submittal. Please do let us know. The type of documentations that we will be asking, that when you submit your invoice, you would need to submit the general ledger, a detailed general ledger for the project, so we can get an idea of where the expenses are and how much you spent. I don't think I want to go into really detail on this right now, as far as
That's fine.
how it looks, but and then we also need you to submit like a summary of a general ledger for the organization that would list out the different programs that you do, what the revenue and the expenses for each of that program, so that it gives us an overview of how how you spent the money and what type of activities that you have as an organization. We will be also requiring a financial activity report. So Ashley, if you could go to that, so that way they get a feel for it. Okay, so yeah, that's the financial activity report that we will be asking for our contractor to submit. This is something that is required under BSK. Along with that, we also, of course, want the invoice to be submitted, and we have our standard template invoice that needs to be filled out. We are not requiring you to, at the time when you submit the invoices, we're not requiring you to submit the detail backup documentation. But I want to let you know ahead of time what type of documents that you need to have and provide to us at the time we have to do site visit, like payroll supporting documents, like the timesheets that would show the hours for the pay period with the breakdown on the different projects that your staff are working on. And the payroll also needs to be, I mean, the timesheet needs to be approved and signed by the employee and the supervisor. And if some of the employee that works on the project, they are exam employees, we just require you to submit a semi-annual time certificate that would show 100% cost objective for the project that they're working on. We also would like to have a payroll registry be provided at the time when we do site visit. The payroll registry, of course, would have the employee names, the payroll period that's covered, the type of hours, whether it's regular, sick, or vacation, the hours, the benefits, and the amount paid along with the check number. That's important for us because, you know, it's as a recipient of federal funding, we need to be accountable to how the money is being spent, and we need to confirm that all the expenses are being paid out to the respective parties. If there were other expenses other than payroll, we will need copies of invoices or receipts. And if you do allocation for any of the direct costs, we do need you to provide us with the allocation methodology, any adjustment that you did on that. So, and we do require a pre-approved allocation plan on your first submittal so that we have an idea of how things are being allocated.
Just to be clear, these are not things that are due with your proposal or anything. These are just things that will happen as your contract moves forward. And I know, Lace, that Somali Health Board is very familiar with Best Starts and King County contracts, but for those, Kiana and Mary Kate, I'm not sure if you've ever contracted with the county, but with Best Starts, there's a lot of capacity building support. So if any of this feels like, you know, overwhelming or too much, there's a lot of support available to help agencies be in compliance and to build their capacity to receive, you know, more grants if that's needed. So.
Oh, yes. Thanks, Amy, for pointing that out. Yes. One other thing that we will need, you know, you could charge indirect costs as you submit your invoice. It will depend if it's whether you have a certified indirect rate that's approved, or if not, we can accept 10% de minimis if you have received federal funding that's 35 million or less. So as I stated there, the 10% is 10% of all direct salaries and wages. Applicable fringe benefits, materials and supplies and services, and travel up to 25,000 of each sub-award. So we cannot include any of the equipment, capital expenditure, charges for patient care, rental costs, and participant support costs to any of this in your calculation. We will be doing a site visit. It's usually, we do this like in the third quarter, but it may happen sooner depending on the workload that we have. And the frequency of the site visits, since this is going to be a 2-year contract, it will depend on
Three.
Yeah, it's a
3
3-year
years.
contract. Yeah, so it will depend on how you as an agency perform in terms of meeting the compliance requirements. So if your agency, you know, in our first site visit shown that you actually meet all the requirements, we don't plan on visiting you again the following year because we know that you are handling your financial activities and meeting all that compliance requirements. But if there are things that we discover in our first site visit, there are things that needs to be corrected, we will have to follow up with you the following year or sooner, depending on the extent of the compliance that's required. So again, the site visit is something that we have to do because we, like I said, as a recipient of public fund, we need to make sure that the money is being spent in the right way. So
Thank you, Sylvia. That's very helpful. Also, I think just to add, for those that do have other Best Starts contracts, that we coordinate so that you're not doing a site visit for one program that you have funding with and another site visit with us, that it's just one is needed, and if you have multiple grants, that's fine.
yes. BSK site visit is centrally managed, so it will be just a one visit, correct? Any question?
Okay, well, if there aren't any more questions, I think we can wrap up. Ashley and I can hang out in case anybody happens to pop in at the very last minute. I kind of doubt it, but we can just make sure that nobody shows up and there's just a blank screen. So, but yeah, feel free if you have other questions, let us know. Reach out to Phil. I know he's happy to help.
After this meeting, any questions you have about the contracting process, the solicitation selection process, Zoom grants technical support should all be sent to me. We try to keep the contact between potential applicants and programmatic staff separate from each other, just so that it doesn't create any appearance of impropriety or any sort of exchange of information that isn't getting sent out to all the applicants. So questions come to me, I will strip off any identifying information, get them to programs, get the questions, relay them back to you, and then post the questions and answers as addendums into Zoom grants. The other thing that I want to say, because this happens fairly often, if you are going to apply, please do not wait till the last 30 minutes. Zoom grants is an old system that works on portal base. So the more people who are in the system at the same time, the slower it gets. And it is fairly common to have multiple people, multiple agencies try and submit their application in the last 30 minutes. And in effect, everyone is trying to go through the same door at the same time, and everyone just starts blocking each other. And then we slip into panic mode. So please don't wait till those last 30 minutes.
Thank you, Phil. All right, well, I think we can wrap up. Thank you, Mary Kate, for coming. Thank you, Kiana. Really nice meeting you.
Thank you all so much. for answering questions and
Yeah,
being
our pleasure.